The COVID-19 outbreak in Italy has put 60 million people on lockdown, and some are worried the U.S. is on a similar trajectory.
The first case of coronavirus in the U.S. not linked to any foreign travel.
This picture has become a symbol of the toll that fighting coronavirus has taken on Italy. A 2-minute rest for a nurse who has worked 10 hours nonstop. In less than 3 weeks, coronavirus overwhelmed the healthcare system across northern Italy. So how did the country go from confidence to quarantine? Hey guys, I'm Dina, and I'm going to break down why the coronavirus outbreak is so severe in Italy and what the US can learn from how they're handling the pandemic over there. So by mid-March, Europe had become the epicenter of the coronavirus pandemic. And on March 19th, Italy's death toll surpassed China's, with over 3,400 deaths and more than 41,000 confirmed cases. But how did it all get so bad so quickly? Let's back up. On January 29th, Italy detected and isolated 2 tourists from China as its first coronavirus cases. Contacts were traced, and Italy cut transportation links with China. On January 31st, Italy's Prime Minister Giuseppe Conte said the system of prevention put into place by Italy is the most rigorous in Europe. But on February 21st, a 38-year-old man checked himself into a local hospital in the region of Lombardy. He had tested positive for COVID-19. It turns out the outbreak had already been circulating locally and unnoticed for weeks in northern Italy. With no lockdowns or social distancing enforced, Italians were still on the streets, and there were mixed messages from politicians. For authorities, it was a balance between keeping the public safe and preventing panic. By March 11th, Italy had the second highest number of COVID-19 infections outside China. Confirmed cases were increasing daily, and the country was unable to slow the spread of the virus and reduce the number of people seeking treatment. Scientists searching for patient zero now believe COVID-19 could have reached Italy from Germany rather than China. But why have coronavirus fatalities been so high in Italy? Well, for starters, Italians were late in taking the threat of the virus seriously. The governor of Lombardy initially said the novel coronavirus was just a little more than normal flu.
Italy did some things wrong, much like other countries are doing things wrong, in the sense that it was very late. Elected officials and just regular citizens really downplayed the threat for a long time. They just weren't taking it as seriously.
Italy also has one of the oldest populations in the world, and we know that those over the age of 65 are among the most at risk from coronavirus. In fact, coronavirus has killed 5% of known cases in Italy. Morgues are at capacity. Makeshift emergency units have had to be assembled, and masks, hand sanitizer, and disinfectant are running out. Because of the delayed response, the healthcare system is completely overwhelmed and no longer has the resources to treat every patient. This means doctors are being forced to make brutal and heartbreaking decisions on who to treat and who is beyond saving.
Direi che siamo allo stremo delle forze proprio.
In a desperate effort to stop the virus from spreading, the Italian government restricted all movement in Lombardy and surrounding provinces, including the cities of Milan and Venice. Police forces were patrolling the roads and giving fines to anyone who entered or exited the quarantine region. 2 weeks after northern Italy had been declared a red zone, Prime Minister Conte said the peak of the outbreak is yet to come.
Il Paese ha bisogno della responsabilità di ciascuno di noi, della responsabilità di 60 milioni di italiani che quotidianamente compiono piccoli, grandi sacrifici.
By mid-March, all of Italy was on lockdown. Even though the situation in Italy is dire, the country is in some ways better equipped to handle the crisis than the US. In fact, compared to the US response, Italy has a number of key advantages. First, Italy has a national healthcare system. This means that all primary and inpatient care is free at the point of use, funded mainly through taxes. It's actually ranked second best in the world. Italy's National Health Service covers all citizens and legal foreign residents.
Even though the health crisis is similar, the system in place it's been there for decades, and people know they can rely on it. People know they can get tested. They don't have to worry about whether they'll get a test. They don't have to worry about whether they'll have to pay for it. If they do end up being hospitalized, they don't have to worry about paying for it or getting a bill later or getting bankrupt.
In contrast, access to healthcare in the US isn't guaranteed, and Americans have to have some form of insurance to get basic care. But many in the US are uninsured, like 28 million non-elderly Americans. Many others are underinsured, meaning they don't have enough insurance. Now, Congress did pass a bill that allows COVID-19 testing costs to be covered for everyone, including those without insurance. But should you test positive, any necessary treatment will not be covered. Then there's the question of unpaid leave. The U.S. has a weak social safety net, meaning many Americans simply can't afford to stay away from work. Second, Italy's far more prepared when it comes to testing for the novel coronavirus. Italy began swab tests early on in the outbreak to monitor the virus. The WHO provided test guidelines that the U.S. turned down for a CDC version. And by the way, that CDC test kit initially failed to accurately record the virus. As of March 17th, Italy had carried out just over 2,000 tests per million people. But getting accurate numbers for how many Americans have been tested is surprisingly difficult, convoluted, and not transparent. Since conducting their first test in January, the CDC reported the U.S. had carried out 125 tests per million people as of March 17th. Finally, the Italian government quickly introduced an economic support package of nearly $28 billion. The money was used to assist the National Health Service and to implement measures like boosting unemployment benefits. The U.S. has injected over $110 billion to help boost the economy during the crisis, but is still deciding how exactly to assist Americans facing unemployment and healthcare shortfalls. So the protections that the U.S. is enacting as an emergency response to a pandemic are standard in the Italian system.
When you have so few protections for workers on a regular basis, it is really difficult to build a system out of thin air and ramp that up overnight. And so that is, I think, the fundamental difference, not just between Italy and the US, but really between any country with a solid welfare system, any European country. Italy just happened to be the one that, was hit first.
U.S. COVID-19 case predictions appear to be rapidly catching up with Italy's and, by some accounts, have overtaken them. So with Italy being a glimpse into the future, what can the U.S. learn from it to take steps to avert the crisis? "I'm staying home" is the new motto in Italy. The government's emergency measures ban all but essential travel and public gatherings like grocery shopping. So people are finding innovative ways to stay entertained while social distancing. Italians are taking coronavirus seriously, with 89% of those polled supporting the government's crackdown. In fact, 78% say they would back even tougher measures. And one measure that's common in countries that have managed to control the spread of the virus, like China, South Korea, and Iceland, is rigorous and expansive testing.
But to suppress and control the epidemics, countries must isolate, test, treat, and trace.
The best way to handle a pandemic, other than acting quickly, is to have a solid system in place. This means having things like a healthcare system that grants universal access without economic barriers to people seeking care, and a social safety net that allows people to take the steps needed to slow the spread without losing their livelihood.
You could potentially massively increase the number of testing, and I think they should. But the overall picture of the system we have in place, that unfortunately is not really something you overhaul overnight, and kind of the middle of a health crisis. I think it's something that we should consider and keep talking about as we go through this and afterwards.
And having a sense of solidarity also helps.
There's a lot of solidarity between Italians right now on a kind of personal level, neighbor to neighbor. You've all seen the videos of Italians singing from their terraces and giving themselves appointments to meet at 6 p.m. every day to sing the same song and things like this. The things that matter have kind of reduced in a way. Money has been the priority in the US for so long that it is so hard to think about putting that on hold and actually care about just people.
Agony in Europe tonight as Italy's death toll passes 10,000. A day after another morbid milestone, 919 dead on Friday, the most in one day in any country. Global cases rising above 650,000, with more than 30,000 dead. The Pope cutting a lonely figure with a special prayer for those facing hunger due to the virus. The 83-year-old and his close colleagues testing negative for the virus today. Despite nearly 3 weeks of a national lockdown, the government now possibly extending that date to mid-April. Police are tightening the rules. Fines increased to up to $3,350, up from $230 earlier. In nearby Spain, authorities today reported 832 more deaths, the country's highest daily count yet, bringing the total to 5,690. This ice rink converted into a makeshift morgue. Hospitals struggling to cope. Health workers infected here at an alarming rate. More than 9,000 contracting the virus. Soldiers today disinfecting hospitals, train stations, and flying a drone to disinfect the streets. A national lockdown extended to April 11. But in China's Hubei province, where the pandemic began, a glimmer of hope. 4 consecutive days without new infections. The region now opening. Shoppers and supermarkets, the metro service prepped to restart. The worry here is a new outbreak coming from outside. Beijing announcing a temporary ban on foreigners coming into the country. But even the most stringent measures struggling to stop the disease.
Yeah, Jose, the recovery rate may be starting to improve. The government said that 1,500 people had fully recovered from the disease in the past day. That's 3 times the number from the day before.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.